Wonderful listeners, you're welcome again to your wonderful and darling station, the Living Radio 90.9 and Living Television. Salah Television, you will always love to watch anytime, any day. And because of the interesting programs and packages we present to our people, because we've always assured you that your satisfaction is what we guarantee here. Today, we are going to have your longer awaited issues of the moment. In today's issues of the moment, we are going to treat something very special and unique because it is what is happening. It's just like the doom of the day, and that is why we've considered it very important. A lot of people, just 2 days ago, a very famous person in one of the famous polytechnics in Niger State died of that same problem. And that is why today we decided to bring an expert who is aware of it, who knows a lot about it, a medical doctor for that matter, who is going to look at it and who is going to treat it. And I'm sure wherever you are, call your neighbor, sit closer so that you also know what it is and how you're going to take care of it. But today we are just going to look at the problem. What problem are we talking about? We are talking about prostrate. What is prostrate? And prostrate, as we were talking today, we're looking at the position. We're also looking at the size. We're also looking at what we call pathological, that is the cause, disease, condition. These are, I'm sure, other things we're going to look at as a concerned prostrate. Prostrate has killed a lot of men, yet a lot of people are surviving it. Do we refer to that as ignorance or what? Whatever it is, I want you to listen attentively and then you hear. Also, it's unfortunate today we are not going to open our phone lines. By next week, when the doctor will come back again, when we are going to do an empirical analysis of not just the major causes and also how to treat it. And that is when we'll open our phone lines so that you can ask your questions. Who are we working with today? In the studio with me here today is no other person but Dr. Emode Damian. Dr. Emode Damian is a surgeon from University College Ibadan, UCH. He is also currently a consultant surgeon to different hospitals as well as the state teaching hospital in Abia State here, precisely in Aba. Dr. Emode, you're welcome to the program.
You're welcome, sir.
Yeah, our viewers, our TV viewers, want to know what is this prostrate we're talking about.
Okay, thank you very much, the moderator. Prostate is just an accessory gland, an organ well positioned. Now, this prostate, its position is so significant in males that without any doubt, anatomically, when people are dissected in the hospital, the prostate stands up there. Now, what is this prostate? Now, the prostate gland is, well, I'll try to be as simple as possible. But medically, the prostate gland is a simple exogenous gland located just below the bladder and in front of the rectum. Now, because of its peculiar position, a lot of problems are attached with these prostrates. And these problems are called the compression symptoms because of this anatomical position, being in front of the rectum and below the bladder, once this structure starts enlarging or have some diseases, of course it affects the prostate.
Okay, that is what the prostrate is. Let us. You also talked about the position and size, and then at what point should one expect this, and why is it peculiar in men?
Okay, thank you very much. Now, naturally, the prostate gland is as small as less than 10 grams, naturally, in a normal situation. In fact, we always relate it to the size of a walnut, the size of a prostate gland. But for some unknown reasons, most times scientists say it's hormonal. This gland starts enlarging, and it could enlarge up to 100 grams. And when such weight occurs in the prostate gland, now the symptoms, of course, starts. I don't know if I should go ahead and dwell on the symptoms straight away.
Yes. It is important to know. I think that the symptom is important for those of them who are listening, so that they will also know when they have.
Now, but before we go to the symptoms, we should also know what this prostate gland does. the function.
Okay.
Now, God, in His infinite mercy, knows that the prostate gland has to be there to perform its functions. Now, naturally, when the spermatozoa are produced from the what we call the Leydig cells or the Sertoli cells of the testis in male, they are of course colorless. Most times are immobile and they look, inanimate. That they don't really move. Now, the prostate gland being an exogenous gland, exogenous means it is an accessory gland, produces secretions that is added to the sperm. And that is why technically when people come to the laboratory, you don't just check the sperm count, you check what we call the semen count, which is the count, the sperm itself, and the fluid, of course, from the prostate. Now, the prostate gland produces secretions that one activates the sperm to be mobile. Two, it makes also the sperm to be antibactericidal. What I mean in this case is, you see, the sperm has a function to perform in the female reproductive organ. And most times that area is too acidic. So if the sperm should go there, it might die off because naturally it's a protein structure. And most proteins are easily destroyed by heat, temperature, and the pH. Now, the secretion from the prostate gland helps it to secure the sperm because of its journey in the female reproductive organ. So it goes this way, it provides nutrients, most times glycogen to the sperm cells because the head of the sperm is heavily nucleated with and needs energy from the glycogen. It also provides motility to the sperm. And of course, it also protects it from bacterial actions. That's the functions of this.
You're saying the prostate is not entirely negative.
It's only negative when it is not well taken good care of, or maybe you neglect the signs and symptoms it's given. Of course, there are some demerit or side effects.
Okay.
But generally, these are the functions, and these functions most times outweighs the demerits. Now, when this prostate start producing these things, and for some unknown reasons, like I said earlier, hormonal issues. When I mean hormonal issues, let us also know that sperm cells are under the influence. The production is a gonic reaction. It requires heat process. In chemistry, we say it's an exothermic reaction. Now, the production of these sperm cells needs a hormone called testosterone, also produced from the testes, under the influence of what we call the luteinizing hormones, and probably some level of FSH hormones. Now, if for some unknown reasons, due to stress, high levels of cortisols, due to acute or chronic bacterial infections of any kind, these hormones could shift. In that case, we call it hormonal imbalance. And that is why I said most cases of prostate disease are purely hormonal. Yeah.
Okay, now we talked about the symptoms because those who are listening want to know what sign one see in his body, or is it like high blood pressure? They say it has no sign, it kills anytime. So you keep checking it from time to time. So these are prostate. Has it a sign?
Yes, definitely. The problem we have, sorry to say it, with the black man is that they neglect these early symptoms and signs. Now, when the prostate starts enlarging, most times they come with very significant symptoms and signs. One, you now notice that you have what we call the dribbling of the urine. The urine starts becoming dribbling in drops. It becomes weak.
It does not flow.
Yeah, it does not flow. And the streams of urine are zigzag. You have weak flow of urine. You also have what we call, like I said, dribbling of urine. It runs in Y section, sometimes emerges. You're seeing them, I think there are no obvious signs. Also, you also start noticing pains around the pelvic regions and associated regions. Most times people feel is probably osteoarthritis. And sometimes too, it also affects the male reproductive functions. So these signs, which are the dribbling of the urine, the weak flow of the urine, that is the streams of the urine, the pains associated with them, are the obvious signs, but people don't really understand until now becomes
it's accompanied with a pain.
Yes, these things come with very severe.
Where is one supposed to experience, observe that pain? Is it in the
around the groin? Remember I told you the position of the prostate is in such a way that it has other accessory organs around it, the bladder below, the rectum in front. You also have some surrounding structures like the intestines, integument, the stomach, and the rest, part of the kidney. So when these things start coming, that means the prostate is enlarging and causing compression symptoms on these neighboring organs. Now, enough that the valves of the urethral valves, which most times are controlled by the autonomic nervous system, do not flow normal. Enough that the flow of the urine does not come the way it's supposed to be. You have incomplete emptying of the bladder. The flow of the urine becomes very weak. You also have pains associated with all these things.
All right, and then I'm sure our viewers out there, I'm sure you're listening. So when you have any of these symptoms, yeah, I think the next thing to do is to run to a nearby hospital and not just a chemist, and go to a professional who understands what does. Okay, as it is, you talked about the disease of the prostate.
Yes. Now, like any other organ in the body, of course, there are diseases. We call them pathological diseases. Now, majorly, I would say that every male from 40 and above should at least once or twice go and do what we call the PSA test. We call it PSA test, prostate specific antigen test. It's run everywhere in the lab. And the normal value for prostate lies between 0 to 4 nanogram per deciliter, 0 to 4. So once yours is higher than 4, I'm not saying you have prostate infection, but that is the time you need to be very, very observant on yourself and start taking some good drugs, probably supplements. We have a lot of them. Now,
There are supplements that can take care of this.
Yes, at that early age.
Okay.
Stage, sorry. Now, at that stage, when you're how do I put, very careful, you don't notice all the symptoms. There are good supplements like prostate defense. I wouldn't want to call names, but we have a whole lot. Now, but when you neglect all this, and at that acute stage, early stage, the prostate can become any of these three phases of disease I'm about to mention. You have what we call the prostatitis. Prostatitis simply means inflammation of the prostate. What I mean by inflammation of the prostate, because this prostate is enlarging, it causes features of inflammation or inflammatory prostate, which are reddening. You start having pains around that area.
Is it in the scrotum or?
For the scrotum, the accessory structures, the bladder, the pelvis, because now the position it is just like the Arab nations and the Israelites. You see, the position of the prostate is such a way that when the symptoms comes, it causes what we call the compression symptoms. All the neighboring accessory structures are compressed. So if it compresses around the integument, the skeleton, you start having pain like osteoarthritis. If you start pressing around the bladder, you now have the ureteric valves, which are controlled majorly by sympathetic and parasympathetic nerves. They start opening, and you have incontinence, flow of urine, not being controlled. And when it affects some other structures like the penix, the penile organ, the man start having weak erection, dysfunctional erection, or weak or what we call poor ejaculation. So the symptoms varies according to the structures surrounding it because of the compression symptoms.
Okay, you talked about the BPH, that is the prostate enlargement.
Yes. So after the first stage, which is the prostatitis,
yes,
the inflammation of the prostate, and you are still not cognizant of what is happening to your body, it now progresses to the enlargement of the prostate. That enlargement means that the cells of the prostate gland become apoplasic. They start enlarging, they start multiplying. And under that situation, when you go to the lab, for instance, that is the situation most people, actually notices it. The value instead of zero, lying between 0 to 4 nanogram per deciliter, extends. You start seeing yourself having 15, 10, 20, and the man is going. And at that stage, you start having weak erection. Sometimes people blame the poor dieting or people do them this or that, but no, it's the prostate. You start having weak erection, you start having poor ejaculation, you start having premature ejaculation, an erectile dysfunction. And all these things because it is enlarging and encroaching the penile organ. And when it approaches the bladder region, the urethra of the kidney, the urine starts coming, incomplete dripping. So that is what is happening. That is the BPH level. Now, from the BPH level, and yet the man is still not noticing what is happening, over time, it now goes to the chronic stage, the long-lasting stage, which is the prostate cancer.
Yeah, I was actually coming to that because it's just like I mentioned earlier, one of very famous person in one of our popular polytechnics in Abia State here had I think that is prostate cancer, and the school were just making arrangements to contribute something to ensure that there is I think surgical operation. At what point does it get to this surgical operation? And how many persons survive it? What are the chances of surviving it when it gets to this level?
Well, first of all, at what chance does it get to that level? Like I said before, it's a progression from the prostatitis to the BPH, the benign prostatic hypertrophy, then to the chronic stage with the prostate cancer. Now, at that prostate cancer, little or not can be done with drugs. I think we need to enter the theater. There has to be a surgery we call prostatectomy.
And if one is not fast about entering the theater, the person may eventually die.
Yes, because of the associated secondary infections and symptoms. It may not really per se be the prostate disease. Because of its encroachment and affections to the other structures, it can now, of course, lead to that.
But what are the chances of survival when it is pronounced prostate cancer?
Well, the chances are very okay. Thank God we have good surgeons in Nigeria and worldwide. With good surgery, of course, we call it prognosis, the chance of survival. The mortality rate is very low. The fatality rate is very low. So the chances of survival is well over 75 to 80%, or even more.
All right, and then as a surgeon, have you had this experience of this prostate cancer, in the hospital and so on?
Yes, I remember one time. In fact, this is one of the cases that I almost lost the patient far inside the village in Anambra State, where I'm from. I wasn't well prepared, and a colleague called me. I wouldn't want to call the name of the hospital, and
you were already a surgeon then?
Yes, and the person was almost gone because there were other secondary infections, So while he also tried to deal with what was on ground, you also have to clear the mess of the blockade somewhere. Yes.
Infections.
Yes. So at the end of the day, the person survives with good medications and chemotherapy.
Now, is there anything one can do possibly to avoid this prostate?
Yes,
Or is it natural?
I was coming there.
Okay.
We have both the natural and the non-natural.
Okay.
Let's deal with the natural.
Okay.
I will advise men, my fellow men, one, most times try to eat very fresh raw tomato. They contain this natural ingredient called lycopene, which is a powerful antioxidant that helps reduce the inflammation of the prostate. You understand? So eating fresh tomatoes, most like you're eating food, just slice it. That lycopene structure, which is a powerful antioxidant, helps in a very, very long way to reduce the inflammation to almost to nil. Then, if you're the type that lives a sedentary lifestyle, I'm talking of the natural, always in the car, in the office, sitting down, computer, try most times to walk. It goes a long way to help the prostate. Also, if you're the type that do cycling, power bike and other, do it minimal. You shouldn't be doing it often to avoid invoking of the enlargement of the prostate. Again, it's very, very important. Once you're just 40 and above, men should always take fish because of the fish oil, the omega-3 fatty acids. Taking red meat also increases the chances of having prostate enlargement. And another thing is milk. At that age, you should stop taking milk. These things help to promote the enlargement of the prostate. Yeah. Then the non-natural way, which of course is supplements. We also advise that, twice in a year, once you are like 35, 40 and above, ensure that you take good supplements. And most importantly, also very, very important, there was a time I was opportunity to speak on prostate at one Redeemed Church, their headquarters. And when I came to this particular topic I'm about to mention, questions were over 100, especially from the women. I advised the men, the spouses, the male counterpart, to always make love to their wife. Because when you do, most times, the incidence of prostrate becomes almost zero. So scientists have been able to find out that, by the time you meet your wife, you have sexual intercourse, it helps to, bring to equilibrium the testosterone level, which of course maintains a level between you having prostrate and the sperm production. So it's good and advisable for married men to always meet their wives regularly.
All right, I was coming to that because I read a magazine where a lady for that matter, that advised men to have sexual intercourse as often as possible.
Yes.
And then like if you are to advise, like how many times in a week? I remember in those days, if you are filling a form and they say sex, so we say 3 times, 4 times. I'm not
now you can also give me a statistical analysis in the sense that check out our forefathers.
Yeah.
How many of them had prostrate? Because they had some had 5, 10,
6 more,
and in a week they rotate themselves. In fact, most times I would say they have shortage of sperm. They need sperm bank. But here, most times we find it difficult to even maintain one. And even that one, most times you're in a mood and she's telling you she's stressed. You understand?
Yeah.
So I mean, if you ask me, and you're eating healthily, in absence of any disease or terrible disease, I mean, 5, 6 times in a week is good.
in a week.
Yes. If you're eating healthily. But because of the economy, at least 3 times.
3 times a week.
Yes. And when I mean 3 times, very good quality ones, not just, you understand?
Not just going and rushing out.
Yes.
Not just rushing in and rushing out.
Prof, you know what I'm saying?
You must take your time.
You take your time so that you can empty the vessel, so that the testosterone can start their work again.
That's it.
All these things sustains the life of the prostrate.
Okay. So one of the key natural things, one, eating healthily.
Yeah.
You must eat well, and then you also talked about tomatoes.
Fresh tomatoes, they contain lycopene, a very powerful antioxidant.
And then the third most important natural one is having sex regular.
Yeah, regular. In fact, the most important. It's just that our women don't want to listen to this. It's very important.
All right. What about this thing? Prostrate, as we speak today, is only found in men and not in women.
Yeah.
Just like fibroid cannot be seen in men, but only in women.
Yeah.
All right. So outside. Is there anything outside the natural food we've talked about? Is there anything one can do to avoid it, to prevent it?
Yes, living a very healthy lifestyle.
Well, when we talk about healthy life, a healthy lifestyle is relative, and then
healthy lifestyle means eating more of natural foods.
Okay.
And trying to avoid junks, especially when you grow up certain age, like 30, 35 and above. Eat more of fruits and vegetables, eat healthily, more of homemade foods and less of junks.
Because when you talk about living healthily, if you see people who are walking out from most of these fast food joints, I think that's what that means. Because even with my experience, a few times I traveled out, I discovered that fast food is only visited by people the less privileged. Wow. Like here, we see it as a big boy.
Just like eating chicken.
Just like
people see it as big boy food.
Big boy food.
While in the Western countries, fish is very important.
It's very important.
And
very
fruits.
important. Yes. All right, Doc. Before I let you out of the hook, before this prospect gets to this cancer, which is more or less the final stage, and that is I wouldn't say the determining point, and this is a point where it can kill. Because there is one, I'm not sure it's buried here, that just happened a few days back in one of our popular polytechnics here in the state, and a young man, I'm sure, is cooling off in the hospital, in the morgue as we speak. And then before he gets to these cancer, prostate cancer, which is I think the most dangerous aspect of this protest, almost incurable. When it gets to cancer, is it incurable? totally?
First of all, let's look at what is cancer.
Okay.
Cancer just simply, you can have cancer of any part of the body. Cancer is just simply abnormal cell division. Not naturally, your body parts or the organs or system or whatever, they have cells. And these cells are controlled, their divisions are controlled by certain factors in the body. Hormones or thereabout. Now, when a part of the body becomes cancerous, it means it has gone out of hand. It's divided profusely in abnormal states. Instead of in arithmetical state, it's going in a geometrical progression. Now, the name cancer does not mean it cannot be cured. In fact, it can be cured. It can. The only thing is, like I said, taking those natural organic things, trying to live natural good life, having all these things I mentioned the natural way, making sure you empty the vessels, and with good chemotherapy too, we can reverse.
Now, Namli, you will attest to this. When we are younger, you discover as a young man, if you are sleeping with a lady, this is a mature program, so there is no need painting words. You discover that if you are staying with a lady as a young man between the ages of 25 to 35, 40, you can go as many times as possible. And as you grow older, the thing gets weaker. Are you saying it's as a result of postrate, or is it natural?
No. Now, this might make us to diversify a little.
Okay.
Now, yes, and I think, let me use a minute to round it up.
Okay.
You see, there is a hormone called cortisol. Cortisol is a corticosteroid. Okay. Now, this cortisol is just a member of the family of corticosteroids. And these corticosteroids are produced from the suprarenal glands, the adrenal gland precisely on top of the kidney. We call it suprarenal gland. Now, this suprarenal gland has three regions: the first layer, the second layer, and the third layer. Now, the first layer produces what we call corticosteroids, and cortisol is one of them. Now, your question is, why are we not performing like the younger time? Now, when we were at youthful age, we don't think much. We eat food, we flex, and because our level of cortisol is very low. Now, as you grow older, like me and you, a lot of economic factors come in. School fees, stress, and whatever. Now, your level of cortisol shoots up. And when it shoots up, it affects hormonal levels. For men, it affects the level of testosterone. Cortisol, when it affects the level of testosterone, it also goes in a negative feedback mechanism to affect your prostrate. And that is why every man between hours of 3, 4, and 5, if he's healthy enough, his male organ should shoot up.
Irrespective of the age?
Yes. You know why? Because without even having thoughts of sex.
Yes.
This is because this hormone undergoes what they call circadian rhythm. It goes like a clock within the body. It is the concentration, the amount is highest in the daytime and lowest in the midnight. Now, the lower the level of that hormone, which we call cortisol, is also called stress hormone, aka stress hormone. The lower it is, the better for us. So when it is lower, which is at the midnight, it allows your organs, majorly your organs and testosterone, to shoot. And when in the daytime there is stress, stress is an environmental factor that affects the hormonal change, which in turn affects the prostrate. So it's not just only prostrate that makes it. Cortisol also plays a role.
All right, our wonderful viewers, this is the much we're going to take today. But before we go, I would want Doctor to remind us, we didn't go just with 1 minute, remind us some of these preventive measures again, and we'll call it a day after that. Doc, please help us with those preventive measures.
Yeah.
Our listeners will want to know.
Preventive measures generally goes in this way: naturally, ensure you eat more of fresh tomatoes. You slice them with onion because these natural ingredients contain powerful antioxidants, namely lycopene, which of course reduces the level of prostrate life. We also, encourage our men to walk briskly most times. Don't always sit in one place, living sedentary lifestyle. Then, majorly, eat healthily, good food, and of course, meet your wife.
All right, our wonderful listeners, you've heard that. It is not all about how much or millions you have in the bank that can make you eat healthily. Remember, it's talking about natural foods, I remember my own grandmother never tasted Maggie until the day she died at the 102 years. In fact, she taught me how to eat plantain in a mortar with just crayfish and so on. Such things don't happen these days. Our vegetables are there and so many other things. Most of this synthetic food has not helped any person at all. And that is exactly what he's talking about, tomatoes. And then for those of you who are married, especially the women, the Bible, I remember in 1 Corinthians chapter 7, he said the woman has no right of her own. You have no right to tell your husband no. And the husband has equally no right to tell the wife no. He said even when you are talking about spiritual things, you two of you must consent with yourself before you do that. Why is he saying that? It's like the Bible is aware of this postrate, and that is why he said the woman always. In fact, if I am interpreting the Bible, what it simply means is that except when you're observing your womanly cycle, that you're not even supposed to go to bed with your panties on. No, it's wrong. So that your husband will live healthily for you. And that's exactly what we're discussing here. We're going to come back some of the time with the more interesting programs on health issues. And remember, our regular person that will be discussing this with us is no other person but Dr. Modi Demian. He will always, his even name is Hugo, and if you look at him, it looks like a dude, if you know what Hugo is, and that's who we'll be having. Doc, I am very pleased and happy to have you today.
I'm glad to have you, sir.
Thank you, and we'll be back some other time. Just keep it with us. Remember, we had updates of St. Moses yesterday. By next week, we're going to come back with another wonderful, interesting health issue that will help you out there. It is important. Remember, it is always important to know. And knowledge is power, they say. And when you equip yourself with this level of knowledge, I'm sure untimely death will not be for us, because God has made it so for us, except for certain accidental things that has been taking us out of our way and out of life. And it will continue this way. Thank you, Dr. Modi, once again. And this is your command, Chinedum Godson Adiele. We'll be back again. Thank you for being there with us. Keep it there with us this time next week.